Now, in today's class, we are starting here the new region that is the abdomen. And today we are going to introduce here how and which topics we are going to take in which sequence as far as the region of abdomen is concerned. Now, if you're looking at this in this diagram, this is a sagittal section of the lower part of the abdomen has been actually shown you here. Now, in this area, if you are actually looking at the first structure that you will come across, it will be the skin. So you see here, this is called the skin. Now, first structure that you come across is the skin, because in this diagram, we are going to show you that abdomen actually basically consists of three things which we are going to discuss. Number one is anterior abdominal wall. Number two, abdominal cavity. And number three, posterior abdominal wall. Now, this is number one, which we are going to show you, and what structures you are going to see here, what clinical important relevant topics you are going to watch in these earlier sessions here. Now, the first thing that you are seeing here is the anterior abdominal wall, if you are actually looking at. This is the number one thing, that is the skin. You see the layers here, which layers you are going to actually pick up here. Now, number one is the skin. After the skin, the next structure is the superficial fascia. And if you're looking at the superficial fascia, this one which we are actually showing you in green, this is called superficial fascia. Surely this is called superficial fascia. And when you will go deeper to this fascia, this blue color, which line which has been actually shown you here, this is called again superficial fascia. This is a second layer of superficial fascia, because in the anterior abdominal wall, we have two layers of superficial fascia. This is also superficial fascia. This layer, which is in fact under the skin, which consists of a lot of adipose tissue here, you call them the fatty layer of superficial fascia. So first layer will be called the fatty layer. This is a fatty layer of superficial fascia. And this fatty layer of superficial fascia is called Kemper's fascia also. And when you will actually go deeper to this, you will see another fascia that is called here the uh, this another layer of the superficial fascia. You call it the superficial fascia, but you call this the membranous layer of superficial fascia. It's very, very important here. Membranous layer of superficial fascia. And this membranous layer of superficial fascia's other name is Scarpa's fascia. These are the three layers you see there. And after that, there will be deep fascia also, but it's the rudimentary. You can actually ignore this fascia. Okay. Deep fascia is not present as such in the anterior abdominal wall, like the deep fascia elsewhere in the body. So in the anterior abdominal wall, deep fascia is not present. You see, if it's present, it is rudimentary, it is ill-defined. So you have here two layers of superficial fascia. And if you are actually looking at this skin of the anterior abdominal wall, it will become continuous. In case of male in this diagram, it will become continuous with the skin of the penis here. You see, it is the skin of the penis here. And then this skin over the penis in a tubular shape will now become continuous with the skin over the scrotum. So skin over the scrotum, you see the skin, which is wrinkled here, obviously. In the scrotum, it's the wrinkled, pigmented, hairy skin. And here, this will become continuous here with the skin of the perineum and the gluteal region, etc. This is the continuation of skin here in the region under the or between the thighs. This is called the perineal skin. So this will become continuous with the perineal skin. And they will become continuous on the backside in the gluteal region. And down in the continuous also with the thighs also, or with the lower limbs as well. This is one. Another thing is this is called the fatty layer of the superficial fascia. This is called now the Kemper's fascia. And this Kemper's fascia, you know that it is called the fatty layer. And this fatty layer is making here thick deposition of the adipose tissue in the superficial fascia here. And this is coming now over it will become continuous over the penis also, but it is very, very less and almost not present here over the penis. But when it is going here into the scrotum, which is again, it will become visible and it will become dominant here. But here important is that when you are actually going in this area, in the scrotum area, Then the scrotum, this superficial fascia, fatty layer will not remain fat here. It will be converted into smooth muscle. You see the red color I am actually showing is the conversion of the superficial fascia, or we say Scarpa's fascia. Say superficial or the Kemper's fascia, it has will become continuous or become continuous with, or you can say it is transformed into smooth muscle. This smooth muscle is called the dartus muscle. It's very important. This is in fact the dartus muscle. It's a transformation of the fatty layer into smooth muscle. It's a mesenchymal under the control of the sympathetic nervous system. So we call it the dartus muscle. It's important here. Dartus muscle is important in thermoregulation of the scrotum. Thermoregulation, I will say the temperature regulation within the scrotum, because the scrotum harbors the male sex gland, that is testis, and it needs a temperature different than the body temperature. And if, for example, you see dartus muscle, and then when it's actually becoming continuous again here into the perineal side, it will become again continuous. In the perineal side, it will become again fatty layer. It converts or transforms again into the fat as it was present elsewhere in the body, as it was present elsewhere in the anterior abdominal wall. So on the back side in the perineum and other areas, it will become again the fat. But only in the scrotum, in the most part of the scrotum, it is transformed into smooth muscle. That's called dartus muscle. These are the three layers which are you actually watching, and underneath it will be the deep fascia, which is rudimentary. You see, you can ignore this. But later on in the anterior abdominal wall is a very important thing here is the muscles now. The muscles which are arranged in three layers, which we'll actually be discussing here, and when we are actually discussing the anterior abdominal wall. The first muscle, that is actually this muscle, which is coming here under the superficial fascia, this third layer, this is called the Scarpa's fascia, which is actually present here. But first you see the Scarpa's fascia. So making here the third layer of your anterior abdominal wall, and then it's making here a tubular sheath around the penis. Now coming here onto the scrotum, becoming the third layer of the scrotum, and when it comes onto the scrotum and reaches here to the perineal region, it will actually be running up to the half of the perineal region, which we will discuss later in the perineum and the pelvis. Up to half of the perineum. You see this blue color, this blue line, which I'm actually showing you here. It will reaches up to the half of the perineum. It's attached here to the perineal body. So it will not actually going here into the posterior half of the perineum. Only interior half of the perineum it will be present here. This fascia, which was above, it is called the membranous layer of the superficial fascia, also called the Scarpa's fascia. But in the perineal region, including the scrotum, it will be called as the Colles fascia. So the third layer, this is here, will become in the scrotum, will become, or in the perineum also, this is becoming Colles fascia. This is called the Colles fascia. That's why they say that if, for example, this is urethra, and this urethra is actually coming into the penis, and before that it is present in the urogenital diaphragm, it is through the prostate and coming from the urinary bladder. So if, for example, this urethra ruptures here, the urine will come into the scrotum. It's not just come into the scrotum, it will come in the perineum also. This we will discuss in detail when the pelvis and perineum will come. So if, for example, you are looking at this, this is the anterior abdominal wall structures which you are actually going to show you. But when you enter here into, after these three layers, you see there will be three layers of the muscles here. Three layers of the muscles means the first layer that you will come across, it will be external oblique muscle. This is number one muscle, you see that? When you are putting the needle through your anterior abdominal wall, reaching up to the abdominal cavity, the first layer is the skin, second is the fatty layer, third is the membranous layer, fourth will be the muscle. That is called the external oblique muscle. And under the external oblique muscle will be another muscle that is called internal oblique muscle, third layer. This is second muscle which you are actually going to show. Internal oblique muscle. Needle will pass through this muscle. This is the fifth, you can say, layer. Second are the muscles, and three will be the cutaneofascial. So these will be actually, this called the internal oblique, and under the internal oblique, we will have actually another muscle also that is called the transversus muscle. Transverse muscle that is called the transverse abdominis muscle. This is the third muscle. This is called transversus abdominis muscle. These are the three layers which you actually see here. After these three layers of the skin and the fascia, then the three layers of the muscles, next three layers will now come. And if you are watching here the fascia transversalis, under the fascia transversalis will come here a fascia, which will not just be under this fascia, and then it will come here into the, say, abdomen also, and in the posterior abdominal wall as well. You see this. Here its name is the fascia transversalis. This is called fascia transversalis. That means it will be the seventh layer from outside in if you are going from superficial to deep. If you are penetrating through and reaching to the cavity here inside to recover, for example, the peritoneal fluid. You see the seventh layer you are actually watching is this called the fascia transversalis. And after the fascia transversalis, you will see here a thin layer of the fat. You see in blue color, I'm showing you here this thin layer of the fat here, which will be touching your fascia transversalis. And on the back side in the posterior abdominal wall, this fat is more prominent here, more dominant. You can see this is a very thick layer here on the back side in the posterior abdominal wall. So this is from inside if you are actually coming. You see from outside, 3 layers of the skin and fascia, then 3 layers of the muscles, and now 3 more layers of the connective tissue. And after this first connective tissue layer, it was, you say, fascia transversalis. The next is this is called the fat here. We will name this also. But when you actually come now deeper to this, you see, deeper to this, it will be the last layer before peritoneal cavity, will come. This is very thin layer, simple squamous epithelium. And this layer, it is called the peritoneum. And this is called peritoneum, and inside it is the peritoneal cavity, in which there will be fluid. That means between your fascia transversalis and the peritoneum, this blue color which I am actually showing you is the fat, and this fat is called the extraperitoneal fat. Mean this set of 3 structures inside, set of 3 structures outside. Sandwich between these 3 and 3, there will be the 3 structures. These are called the muscles in between. Means there are 9 layers the needle will actually come across when you are actually going from outside in. Till you reach to the 10th thing here, that the 10th structure, that is the peritoneal cavity from which you will recover your peritoneal fluid. So this will be the 10th structure. That means 10 structures your needle will pass through from skin until the last layer, that is until the last thing that is called the peritoneal cavity. These things are in fact present near anterior-abdominal wall, and in this area, especially when you are actually discussing your muscles here. So you will not just discuss the muscle, fascia and other things, but you will discuss the muscles. Means you will discuss the muscles separately. And when you discuss the muscles separately, in the central, we don't have just 3 muscles. We have in the center, we have got a rectangular muscle in the center on either side of the midline. We call this the rectus abdominis, and that is actually covered with a fascia, with a very important sheath here, that is called the rectus sheath. Very important here. This you will discuss also. Not only this, but in the muscles, as you see, look at the muscle. The muscles, in fact, between the muscles, very close here to your inguinal ligament here, you will see, because the inguinal ligament itself is a part of the muscle. And if you actually be seeing here, just above the inguinal ligament, you will see in between the muscles, there is a cleft, which runs above and parallel to the inguinal ligament. Here we call it the inguinal canal. And in the inguinal canal, again, very important structure, which you are going to discuss in this. And in inguinal canal, you can have the hernia also. This is called the inguinal hernia. This also. And at the same time, scrotum, it's a structure. This you will actually have to discuss in this also. And when you will actually discussing these things here, you will be, in fact, watching certain other things. Like, for example, if inguinal canal, rectus sheath, and muscles here. So muscles you are actually watching. So superficially deep inguinal rings and all these structures. And not only this, but scrotum, at the same time, inguinal canal, there contains rectus sheath muscles. You will discuss these things in your anterior abdominal wall. So 5 or 6 important things you have to discuss. And when you discuss them, anterior abdominal wall, under certain headings, then there are clinical correlates you will actually, clinical relevance, the topics which are clinically relevant. You have to focus them. And if you have a basic of all these things along with the clinical correlates, then the scenario will be very, very easy for you to understand and to answer. This is something you are actually watching in the anterior abdominal wall. Now, if, for example, you will cut all 9 structures, so we reach here to the tenth thing here that is called the peritoneal cavity. You call it abdominal cavity also. So the second region that you will actually enter inside, it will be the abdominal cavity. Let's see in the next session what you are going to watch in the abdominal cavity. Now, in the second part of our this discussion regarding the abdomen, we are going to focus here in another part that is called the abdominal cavity. After we have removed the almost 9 layers of the anterior abdominal wall. Out of this, the 3 were in the previous sessions. You have seen that the 3 are skin and the fascia. This called the skin, fatty layer of the superficial fascia, and the membranous layer. Then the 3 layers of the muscles, external oblique, internal oblique, and the deepest will be the transverse abdominis muscle, and then 3 layers of the connective tissue are the epithelium, that is the fascia transversalis, extraperitoneal fat, and the parietal peritoneum. 9 layers we have removed here to enter into the peritoneal cavity, where the peritoneal fluid, in fact, will splash out here. You see, we are opening the abdomen here, that is called the laparotomy also. In the midline, we are actually having here a median incision here, the long median incision longitudinal, where you will open the abdomen here. See this diagram. In this diagram, you have opened it. Open the anterior abdominal wall. See in this transverse section of them. In the transverse section, what you have removed here to show you this. Now see this one layer that you have removed here, the skin. And in another layer, you have removed here the superficial fascia, fatty layer. Then the membranous layer, blue color. You are watching in the central region, these are the rectus abdominis muscle, you have removed this. These 3 muscles, you see the 3 layers you have removed. And now these are the 3 deepest layers. You will see this is called the fascia transversalis, remove this. And then extraperitoneal fat, remove it also, and then the parietal peritoneum. When you are removing the parietal peritoneum here, means you are opening the book like here. This is opening. And opening here, you are seeing this. This is called the gastrointestinal tract, any part here. This is called here, okay, small intestine. You are watching here the small intestine. You see all the small intestine loops are the coils you are actually seeing in the middle. This is small intestine starting here from the jejunum. You see starting from the duodenum, jejunum, and ileum. But you see it's arranged in the center, it is okay. But when you have removed all these 9 layers, skin and fascia, then the 3 muscles, and then the 3 layers of the fascia transversalis, extraperitoneal fat, and the parietal peritoneum, if you're removing them and the peritoneal fluid is actually has been removed or recovered here, you are watching here. When you will actually see, you can't see this, the small intestine in the middle. You will see, in fact, here, like a blanket here, there will be a fat embedded within the peritoneum, embedded within the greater omentum. You will see actually, you can't see these coils of the intestines. In fact, after removing these 9 layers, you can't see them because all they will be hidden by this blanket of greater omentum. If you want to see them, your greater omentum has to be reflected up here. Do you see this? It was like a blanket here. We have reflected here. This is called the greater omentum. This greater omentum, this is a double layer of peritoneum. That we will discuss later. But you see, this is a peritoneum. We call them greater omentum. And greater omentum is in fact covering the central part of your abdominal cavity, where suspended are these coils of jejunum and ileum here. You see these all coils of jejunum and ileum in the center. And when the ileum actually finishes here at the right iliac fossa, large intestine starts. And the large intestine starts here. So you see these are called the jejunum, and this is called here the ileum. You can say some 20 feet long small intestine here, and 1 foot will be duodenum also. 21 feet long intestine, small intestine, starting here from. But before that, we have the stomach and a part of the esophagus also. The stomach and a part of esophagus, just half an inch of the esophagus. infradiaphragmatic portion here, abdominal part of the esophagus. And at the same time, we have got here under the diaphragm, liver also. At the same time, biliary duct, gallbladder, and all these things we actually will see, including even the spleen as well. So in the peritoneal cavity, in the abdominal cavity, these things we will actually have to watch here. So what you have to see in these structures, I told you that first thing will be esophagus, then stomach. In sequence we will go, like in duodenum, jejunum, ileum. These three are called small intestine. But at the same time, we have got here, you see, this is called cecum. Suspended or attached to the cecum is appendix. And cecum becomes continuous with the colon. And colon means you call it ascending colon. Then this is called a transverse colon. This will be the descending colon. And that will dip into the pelvis. You call it the pelvic colon, or you can call it the sigmoid colon. Sigmoid colon will be part of the pelvis. We will not discuss it in the abdomen. So all these four parts plus cecum and appendix, 6 parts, and sigmoid colon that will become continuous with the rectum. That will be also the pelvic structure. And then the anal canal, that will be the perineal structure. All these together, because some part of the GIT we will discuss in the pelvis and the perineum. But these structures we will discuss here. But not only this, but the glands connected to that. That is called biliary system and the liver also. Means along with them, you see, you have to discuss here one thing that is called the pancreas. And another is the liver. Connecting both is the biliary system. And along with that, don't forget one more thing is the spleen. These structures we will discuss in abdomen. And we have actually seen here in the abdominal cavity. It's a longer part. And when you discuss all these things, then you will discuss here the neurovascular bundles. Neurovascular bundles means the arteries, veins, and the nerves and the lymphatics together. Together means when you are discussing here the esophagus or stomach, don't actually mention its blood supply, venous drainage, lymphatics, etc. of the stomach only. First of all, see the anatomy of these things and the clinical relevance or the clinical important facts about these structures in sequence. See the anatomy first, and then the blood supply of all the structures together. Because all the blood is in fact is coming from the retroperitoneal structure, that is called here the aorta, and this is giving long blood vessels here straight into the various parts of the gastrointestinal tract. But here you are watching the abdominal cavity, and these structures are present here. And if you see these structures, your anterior abdominal wall almost is having the identical configuration like in the posterior abdominal wall is. But if you are removing all this, for example, if you remove all this colon, etc., all these things you are removing. Now see this remove. Means what you have removed last, you have removed here, last thing is the parietal peritoneum. Means if you remove the last thing is the parietal peritoneum, where you have entered into the extraperitoneal fat. Have you entered into the extraperitoneal fat? Means in the extraperitoneal fat is suspended and embedded here the extraperitoneal structures, because it is extraperitoneal, behind the parietal peritoneum obviously, related to the body wall. But this area, extraperitoneal area, will be present laterally as well as anteriorly. So this is actually present interiorly and laterally both. But on the posterior side, the extraperitoneal fat is abundant. It's too much here because a lot of structures in the posterior side is in fact are suspended here in the extraperitoneal fat. So here we call it the retroperitoneal fat. I say call it the retroperitoneum. So this compartment is very important because it is giving shelter here to the pair of kidneys, great vessels, and all these things here, suprarenal glands and many other structures. So these are in fact present here. So when you will actually be cutting all these anterior abdominal wall and removed all your peritoneal, I say abdominal structures, all of them, if you remove them, you will reach the posterior abdominal wall. And where you have entered? You have entered into the retroperitoneum. So you will come across the retroperitoneal viscera. And when you remove these retroperitoneal viscera, you will come to the posterior abdominal wall from inside. And from inside, what you will see? From inside, what you have removed first? You have removed from here you say one structure that is called the parietal peritoneum. Then second structure will be your extraperitoneal fat. Then third structure will be your fascia transversalis, which on the back side will not be called as the fascia transversalis because back side we don't have transversalis abdominis muscle. Here its name will become soft fascia. Fascia covering quadratus lumborum, like that. So if this is actually present, so three structures are there, and then on the posterior abdominal wall also we have got the three layers of the muscles, which we will actually be seeing them later. But you see all this here. So removing all this say peritoneal abdominal structures, you will go to the posterior abdominal wall. And you go to the posterior abdominal walls, first you will come across the posterior abdominal wall viscera. And when you remove them, for example, in the middle aorta, and the right side will be the inferior vena cava, giving their branches all over, and the two sides will be the two kidneys. On the top of the two kidneys will be the suprarenal glands. And if you remove them all, then you will be having here a totally clean posterior abdominal wall from inside. Inside means how many layers of muscle? 3 layers. Which muscle you will feel from inside? It will be the third layer, obviously, because you are going from inside. Remove the third layer, the second, the first. And after first 3 layers of the skin and superficial fascia will come. And you will see that in the next session when we will actually change this diagram. Now, look at this diagram where we have approached in this posture. Now, if you are looking at this, we have already told you that we have removed from here all the 9 layers, means 3 layers of the fascia, I say skin and the fascia, 3 layers of the muscles, 3 layers of the connective tissue and the peritoneum, and we have removed here even the peritoneal cavity till you reach here to the posterior abdominal wall, which in fact will be having here, right from here skin up to parietal peritoneum were 9 layers. So parietal peritoneum was the 9th layer. But if you are actually looking at your posterior abdominal wall, the parietal peritoneum right from here will be the first layer. And you have removed the parietal peritoneum, you reach actually the 8th layer, but from inside it will be the second layer. This is the extraperitoneal fat, and here the extraperitoneal fat is called the retroperitoneum. You are here in the retroperitoneum, and you are looking at retroperitoneal structures. This is the diagram that reflects here. That means you are seeing here the two kidneys. You see the two kidneys here. You are seeing from the two kidneys are emerging now the two ureters. You see the two ureters here. So that means you are looking at the ureters and the two kidneys here. See the kidneys. So all these structures which I am showing you in this diagram, these are all extraperitoneal, I say retroperitoneal structures. You see that this is called the kidneys. On the top of the kidneys, we have got suprarenal gland. And you see emerging from the hilum of the kidney is the ureter. And you are watching not only this, but at the same time in the posterior abdominal wall, if you are seeing in the retroperitoneum, here is aorta. And on the right side, it is the inferior vena cava. On the other side is the kidney also. Suprarenal gland. And see ureter. And when you are coming down here, you see the all these structures. The ureter. And you are looking all these structures, they are actually going into the pelvis here. These are pelvic structures. We will discuss them in the pelvis. But here, these are all retroperitoneal in this region. That means we have removed peritoneal cavity. I say removed peritoneal cavity, the peritoneal viscera, etc., everything. And now actually remove the parietal peritoneum to enter now into your posterior abdominal wall. So means 9th layer of your posterior abdominal wall has been removed. And you are in the 8th layer, that is called the retroperitoneum. In the retroperitoneum, there are a lot of structures you are seeing here. Inferior vena cava, aorta, pair of kidneys, pair of suprarenal glands, pair of ureters, all these things. But you see that if you are saying these structures are there, okay, we agree. But problem is there, why the cecum, ascending colon, not the transverse, descending colon, even the duodenum, most of the part, and even the pancreas also, which were in fact the part of the gastrointestinal tract. Why they are present in the retroperitoneum? They are very much intraperitoneal. And you have seen these all were actually intraperitoneal suspended within the mesentery. Why they are present? We will discuss them when we will come into the peritoneal cavity. We will tell you that these structures, they were in fact intraperitoneal in the beginning in embryological setup, but they have become secondary retroperitoneal organs. So they will be in fact sleeping upon as a sleeping antereto, and they are hiding the already originally occupying, say, already originally situated retroperitoneal organs. Means primary retroperitoneal organs, they will be hidden partially by secondary retroperitoneal organs. So you are you see many parts of your gastrointestinal tract. If you see starting from your esophagus, no. Stomach, no also. Duodenum, some portion, it is totally intraperitoneal, but the rest of all duodenum, almost it is extraperitoneal, I say retroperitoneal, has become retroperitoneal. That's why it is present in this diagram. So it is present in the retroperitoneum. And when you have removed this retroperitoneum, this is after that, jejunum, ileum, etc., everything is intraperitoneal. But you see here, the cecum, ascending colon, all they are retroperitoneal, but the transverse colon is not. And descending colon is yes. And sigmoid colon we can't see here. And if you are actually looking at this and you see this aorta dividing into the two common iliacs, and you see this. But these are all things we will actually discuss one by one. So in the in this area, in the retroperitoneal, when you enter into the retroperitoneum, you have to discuss here the kidney, suprarenal glands, ureter, and then aorta, inferior vena cava. At the same time, some lymph nodes, important lumbar lymph nodes, and then autonomic nerves also. And at the same time, you see lumbar plexus as well. These structures we will discuss in the posterior abdominal wall. In the retroperitoneum, most of them, they are in the retroperitoneum. So you are looking at this structure. And when you are actually removing all these retroperitoneal structures, so cleaning them total, you will actually see clean posterior abdominal wall. What you have removed, actually what you will remove now, you see, from inside, ninth layer, eighth layer you remove, means extraperitoneal fat you remove. And along with that, all viscera will come and they will be removed also. Fascia, that is called the fascia transversalis, whose equivalent here are analogous, you see that will be the source fascia, remove that. Now you will see three layers of the muscles, just like in the anterior abdominal wall. And here centrally on either side of here midline, and here on the either side of midlines on the both sides of your spines of your vertebrae, erector spinae muscle. So here you will see this, and on the sides you have got three muscles each in layers again till you reach the three layers of the skin and the fascia. So you are actually going in this, and if you remove all this, you will reach this, and you will see what you will actually be watching here in the posterior abdominal wall after you have removed all these structures, which I'm actually showing you here. But before you will actually remove all, you have to discuss all these structures. This will be our third session when we will discuss this. So in the beginning, anterior abdominal wall, then later on, abdominal cavity, then posterior abdominal wall. So it will be actually three steps in which the abdomen will be discussed. And the anterior abdominal wall, I told you that you have to discuss the anterior abdominal wall, how it is formed, what are the muscles, where the origin section of these muscles is, and due to the composition of this interior three layers of the muscles, there will be one important structure here that is called the cleft, or the space between the muscles, that is called the inguinal ligament, and inguinal canal. And if the inguinal canal is there, then inguinal hernia is important in this. Rectus sheath, the rectus abdominis is supporting your central portion of your anterior abdominal wall, so it will be ensheathed in the aponeurosis of these three muscles which are there. Rectus sheath has also some important clinical relevance here. And at the same time, scrotum also, anterior abdominal wall extension here, and some more things you will see in the anterior abdominal wall. And then you will open it, you will enter into the abdominal cavity where you will see the gastrointestinal tract, along with the hepatobiliary tract also, including pancreas and spleen as well. And after you have done all abdominal cavity, then you will come to the retroperitoneum, posterior abdominal wall. First of all, it will viscera, which I have shown you here. All these viscera you will discuss. And when you have discussed all these viscera, now the wall you will discuss, because you are going from anterior to the posterior side. So wall means these three muscles again, and many other things also. Watch in the next diagram which muscles you are going to discuss as far as your posterior abdominal wall is concerned. It's not as important as your anterior abdominal wall, but it is surely important. You have to actually see here, because in this in the posterior abdominal wall, embedded between the muscles, in fact, will be your spinal nerves, like lumbar plexus. At the same time, vertebral column, lumbar vertebrae has to be done, because vertebral column was not present anteriorly, so we didn't actually do any bone in the anterior abdominal wall. But posterior abdominal wall, you will see that we have 5 lumbar vertebrae, but we will discuss at least one typical lumbar vertebra. Means in the abdomen, you have just one simple typical lumbar vertebra that you have to discuss. Almost boneless region, you can say. But you have got just one lumbar vertebra that you have to discuss in the abdomen. Come and see the last diagram of your abdomen, how post-abdominal wall muscles actually look like. Now, see, in the last session of the introduction to the abdomen, you watch here, we have removed, in fact, everything here. If you look at this diagram in the transverse section, we have removed here anteriorly all the 9 layers of your anterior abdominal wall, removed. The posterior abdominal cavity, viscera has been removed also. And so much so that the posterior abdominal wall, same 9 structures from inside the parietal peritoneum has been removed. This is 9th layer. And you have entered into the 8th layer, that is called the extraperitoneal fat. We call them retroperitoneum. All the viscera in the retroperitoneum, whether primary or the secondary, as secondary retroperitoneal or primary retroperitoneal organs. Primary means the kidneys, suprarenal gland, and great vessels. And secondary means the GIT organs, including pancreas. All these organs you have removed here, and you are removed the extraperitoneal fat, and you have removed even your I say from inside 7th layer, there is the fascia transversalis, which in fact behind will be called as the psoas fascia, or downward it will be called as the fascia iliaca. You have removed that as well, and now you are looking at the 3 layers of the muscles. In fact, 3 layers of the muscles, and after that the 3 layers of the skin and fascia. But you will see that 3 layers of the muscles in such a way that if you look at this here, this is called here the psoas major muscle. So you see first here the psoas major. And if the spinal cord is present here in your lumbar vertebrae, for example, and in your thoracic also, because spinal cord stops at the lower border of the L1. And from here, when the spinal nerves comes, the interior rami of the spinal nerves, they enter into the psoas major muscle. And within the psoas major muscle substance, they will form here a plexus that is called the lumbar plexus. And from lumbar plexus will emerge now the branches here from its lateral border, from the lateral border of psoas major. From lateral border of psoas major, I'm sorry, not here, this is green color, but it's in red color muscle. And many nerves will emerge from the psoas major, from lateral border especially. 1, 2, 3, 4, and one through the substance and one from the medial side. 6 muscles will emerge, just like you see sprout from the psoas major muscle. Because within the substance of psoas major muscle, the interior rami of your spinal nerves, the lumbar spinal nerves, they are embedded, they are in fact taking shelter here, but they will mix up together to form the plexus. We call them lumbar plexus. And if this is here, so here in the posterior abdominal wall, you are watching. On the lateral side, you see this muscle that is called the quadratus lumborum. This is second layer. And in the third layer means from inside, if you are going here, the layer number, it will be 6, psoas major. Layer number 5, you are going outside here, is a quadratus lumborum, just superficial to that. And most superficial being here, which you can feel at the latissimus dorsi. This is what we call here the muscle. So you see here 3 muscles now. You are removing here, I say, psoas major, removing quadratus lumborum, removing your latissimus dorsi. And then you will come to the fascia and the skin. And in these areas, you are actually watching here the psoas major. And see, the psoas major is present above, but when you are actually reaching here into the lower side, abdomen doesn't have bone, but you see you are going down here, iliac fossa, this is actually the part of abdomen. So here in the abdomen, you will see here the muscle. Psoas major continues, here another muscle is added, that is called the iliacus muscle. This is called the iliacus muscle. Iliacus muscle, and then above, this is called the quadratus lumborum. And they will be most superficially supported here by your processes, called the latissimus dorsi muscle, and partly by the trapezius also. If this is will be actually, yeah, like your muscles are there here, this is your posterior abdominal wall, and in between you have got a vertebra, so one vertebra you have to discuss. Means in the posterior abdominal wall, and so much so that on the 2 sides of vertebral column we have here sympathetic chain. So in the posterior abdominal wall, when you're looking at the muscles, for example, wall only, then you have to discuss lumbar vertebra, at least one lumbar vertebra. Then the muscles, 3 muscles. Then lumbar plexus. And then will be the sympathetic chain. So we have these 4 structures to develop here in your posterior abdominal wall. So this was in steps, in stepwise, not just these structures you will see in the anterior abdominal wall. very important structures. Yeah, then you enter into your abdominal cavity where you see the viscera, their blood supply, etc., all the anatomy and their clinical correlates. And then you will go to the posterior abdominal wall where you will see the structures are the viscera of the posterior abdominal wall and then the posterior abdominal wall itself. And all these structures you will actually see, not only the structures anatomy, but their clinical facts also, the clinical correlates also. And then if you discuss these and their basic you have got in your grip, you see that clinical scenario will be very, very easy to understand here in any type of exam here. This was introduction to the abdomen. तो अभी आपने यहाँ पे देखा ना, मैंने आपको बताया कि एब्डोमेन को जब मैंने इंट्रोड्यूस कराया तो एब्डोमेन को आप तकरीबन यूँ समझ लो कि आप 4 स्टेप्स में पढ़ें, 3 स्टेप्स में चलें या 4 स्टेप्स में पढ़ेंगे। सबसे पहले एंटीरियर एब्डोमिनल वॉल का स्ट्रक्चर, इसी डायरेक्शन में आप जाएं, एंटीरियर एब्डोमिनल वॉल के स्ट्रक्चर को पढ़ेंगे जब, तो आप एंटीरियर एब्डोमिनल वॉल को देखेंगे कि ये कैसे पेरिनियम के साथ कंटिन्यूस है, स्क्रोटम उसमें देखना होगा, स्क्रोटम का स्ट्रक्चर, ये सारी चीजें। और उसके बाद जाहिर है मसल्स की ओरिजिन इंसर्शन देखेंगे तो कुछ रेमिफिकेशन, उसकी कुछ मॉडिफिकेशन समझ में आएंगी। फिर उस मसल्स के बीच में होगा इंग्वाइनल कैनाल, और इंग्वाइनल कैनाल है अगर तो फिर इंग्वाइनल हर्निया के बारे में आपको पता होना चाहिए। फिर इस बीच में आप देखेंगे रेक्टस एब्डोमिनस मसल, तो वो रेक्टस एब्डोमिनस मसल रेक्टस शीथ में एनक्लोज्ड है और रेक्टस शीथ को देखना होगा। ये एंटीरियर एब्डोमिनल वॉल है, और एंटीरियर एब्डोमिनल वॉल के अंदर उसकी वॉल के न्यूरोवास्कुलर बंडल्स वगैरह फिर हमें देखना पड़ेगा कौन सी इंसिशंस हम मूवमेंट देते हैं और उनके साथ क्या क्या डैमेजेस हो सकते हैं। फिर आप इनको लेयर्स को काटें और देखें, और पता होना चाहिए आपको कि सीक्वेंस में ये किस तरीके से स्ट्रक्चर्स पड़े हुए। तो आपसे अगर पूछेंगे कि क्या सीक्वेंस है, आप एक नीडल पास करते हो, आप पैरासेंटेसिस करते हो और पहुंचाते हो अपनी नीडल के टिप को इन द पेरिटोनियल कैविटी, तो पेरिटोनियल कैविटी वो 10वीं स्टेप्स पे आती है। तो स्किन सुपरफिशियल फेशिया, ये किस तरीके से इस सीक्वेंस में लेयर्स हैं, और इस रास्ते से जब आप लेटरली या मिडिल में आप कोई चीज पास करते हो तो कौन कौन से स्ट्रक्चर्स आपको कम क्रॉस करेंगे, क्या क्या डैमेज हो सकता है, ये क्लिनिकल कोरिलेशन। और इसके साथ जब आपका एंटीरियर एब्डोमिनल वॉल कंप्लीट हो जाए तो आप एंटीरियर एब्डोमिनल वॉल को खोलें और पेरिटोनियल कैविटी में या एब्डोमिनल कैविटी में अंदर आए, और वहां पर फिर आपको पेरिटोनियम को बताना होगा कि पेरिटोनियम क्या है, क्या रिफ्लेक्शंस हैं उसकी, क्या लिगामेंट्स हैं, और इस साथ गैस्ट्रोइंटेस्टिनल ट्रैक्ट को और उसके सारे ऑर्गन्स उनकी एनाटॉमी करनी है, और इसके साथ साथ जो ग्लैंड्स हैं बिलियरी ट्रैक्ट वगैरह, और साथ में लिवर, पैंक्रियाज एंड स्प्लीन। ये करने के बाद फिर उनके न्यूरोवास्कुलर बंडल्स एक साथ, हर ऑर्गन का अलग अलग नहीं, एक साथ उनके न्यूरोवास्कुलर बंडल्स, एक दफा एओर्टा उठाया और उसके ब्रांचेस को फैला दिया, और उसके साथ साथ फिर रिटर्न में वेंस लेके आए और साथ में पोर्टल सिस्टम वगैरह। ये आपका एब्डोमेन और उसके विसरा होंगे, और उसके बाद जैसे एब्डोमिनल विसरा को रिमूव कर दिया आपने तो आप पीछे पहुंच जाएंगे पोस्टीरियर एब्डोमिनल वॉल पर, और यही 9 लेयर्स जो फर्स्ट से लेके 9th तक गए थे तो वहां से फिर 9th से लेके फर्स्ट तक जाएंगे। तो पेरिटोनियम को जैसे हटाओगे तो जैसे यहाँ था एक्स्ट्रा पेरिटोनियल फैट, तो उधर भी एक्स्ट्रा पेरिटोनियल, लेकिन क्योंकि बिहाइंड है इसलिए इसको कहते हैं रेट्रो पेरिटोनियल फैट, और उधर ही होती है आपकी किडनी, सुप्रारेंडियल ग्लैंड, ग्रेट वेसल्स वगैरह। लेकिन वहां पर जाके पता चला कि कुछ पेरिटोनियल या जो इंट्रापेरिटोनियल ऑर्गन्स थे वो रेट्रोपेरिटोनियल हो गए हैं वहां पर। तो कुछ रेट्रोपेरिटोनियल ऑर्गन्स जीआईटी की शक्ल में आपको मिलेंगे, जैसे ड्यूडिनम, जैसे असेंडिंग कोलॉन, डिसेंडिंग कोलॉन, इवन पैंक्रियाज पूरा ऑलमोस्ट सारा सवाए टेल के, वो सारी चीजें वहां पर आपको रेट्रोपेरिटोनियल मिलेंगी। तो वो विसरा आपको वहां पर पोस्टीरियर एब्डोमिनल वॉल में करने पड़ेंगे, और जब उन विसरा को हटाओगे तो पोस्टीरियर एब्डोमिनल वॉल खुद नजर आएगा, और फिर उनको देखना होगा। वो भी इसे 3 लेयर्स में, जैसे सॉस मेजर, क्वाड्रस लंबोरम, पिलेट्स मेटार्सी, और यही स्ट्रक्चर्स। और फिर पीछे आप जाकर पोस्टीरियर एब्डोमिनल वॉल में देखोगे कि उन्हीं से मसल से ओरिजिन ले रहा होगा कुछ उनके फेशियाओं वगैरह, फेशिया से आपका डायफ्राम भी। तो डायफ्राम भी पोस्टीरियर बॉडी वॉल का एक बहुत इंपॉर्टेंट पार्ट है। ये सारी चीजें आपको एब्डोमेन में मिलेंगी। तो एब्डोमेन इन्हीं के साथ एक एक स्ट्रक्चर करके लेके आगे चलेंगे, और अगले फ्यू वीक्स के अंदर हम एब्डोमेन को इन तरीके से हम खत्म करेंगे। तकरीबन मेरा ख्याल है कोई 40 के करीब टॉपिक्स होंगे, छोटे छोटे टॉपिक्स होंगे, और उसके बाद इनके कोरिलेशंस साथ साथ करते जाएंगे। कोशिश करेंगे साथ साथ करने की, अगर फिजिबल है तो, नहीं है तो फिर एक साथ ही कर देंगे। और फिर ये जब आपको आ जाएगा, बेसिक बहुत इंपॉर्टेंट, बेसिक अगर आपको नहीं आया तो क्लिनिकल कोरिलेशन किसी काम की नहीं, क्योंकि जब आपको बेसिक नहीं आएगा, बेसिक आएगा अच्छे तरीके से तो फिर क्लिनिकल, नॉर्मल आएगा तो एबनॉर्मल समझ में आएगा, और जब नॉर्मल एबनॉर्मल को दोनों को मिलाओगे और समझ में आपको आ गया तो फिर कोई सिनेरियो आपको बताएगा तो आपका ब्रेन, आपका जो माइंड है वहां नेविगेट करेगा, आपको पता चल जाएगा क्या बोल रहा है, क्या होगा, यहाँ कौन सी रिलेशन है। ये अगर फॉर एग्जाम्पल अगर टेल की बात हो रही है ऑफ पेंक्रियाज की, तो टेल ऑफ पेंक्रियाज किसके साथ है, स्प्लीन के साथ रिलेटेड है, तो स्प्लीन के साथ उसका क्या रिलेशन हो सकता है। ये जब आप आगे बढ़ेंगे तो आपको आइडिया होगा, तो आपके लिए काफी चीजें ये आसान हो जाएंगी आगे। तो हम इसी तरीके से चलेंगे, फिर आपके लिए किसी भी टाइप का एग्जाम कोई माने नहीं रखता, बड़ा आराम से आप कर सकते हैं, इतना मुश्किल नहीं है, लेकिन उसको एक सीक्वेंस के साथ जाना, पहले बेसिक, फिर उसके क्लिनिकल कोरिलेट्स, फिर उसके क्लिनिकल केसेस फॉर होमवर्क पर्पस, वो आपको दिया जाएंगे, आप जाके घर करें, और फिर आखिर में सिनेरियो कैसे आते हैं और किस तरीके से वो फिर एक जो हम मॉक टेस्ट वगैरह लेंगे या उस दौरान आपको टेस्ट मैं भेज दूंगा, वो आप करके मुझे आप बताएंगे। और जहाँ जहाँ जो डिफिकल्टी है वो आप सॉल्व करते जाएंगे, आपको इस तरीके से ये सारी चीज़ें आसान हो जाएंगी। एक दफ़ा आप अगर ये सारे रीजन जैसे एब्डोमेन है, थोरेक्स भी ऐसे ही करना था, किया होगा आपने, जैसे एब्डोमेन है, जैसे पेल्विस है, आगे चल के जैसे हेड एंड नेक है, और उसके बाद जैसे ब्रेन है या न्यूरोनाटमी है, इसको अगर इसी तरीके से आगे बढ़ाएंगे और 4 स्टेप्स में इस तरीके से हम करेंगे, यानी पहले बेसिक्स और उसके बाद, और फिर बेसिक में हम यहाँ पे देखेंगे कि जैसे अभी हमने आपको बताया एब्डोमेन को 4 बेसिक्स के, एब्डोमेन बेसिक को हमने 4 इसमें तकसीम किया है, जैसे एब्डोमेन, एंटी एब्डोमिनल वॉल, एब्डोमिनल कैविटी, पोस्टी एब्डोमिनल वॉल, चलो 3 हिस्सों में। देखो पोस्टी एब्डोमिनल वॉल में उसके विसरा बिन वॉल, एंटी एब्डोमिनल वॉल सेपरेटली, फिर उसके अंदर कैविटी, और कैविटी के विसरा हमने की। तो 3 हिस्सों में किया, और हर एक के बेसिक, क्लिनिकल, क्लिनिकल केसेस एंड देन सिनेरियो, हर एक जगह पर इसी तरीके से यहाँ पर 4 हिस्सों में यहाँ पर। तो पूरे रीजन को सब रीजन्स में डिवाइड किया, और हर एक सब रीजन में चार दफा उसको 4 स्टेप्स में किया हमने, बेसिक, क्लिनिकल कोरिलेट्स, केसेस एंड देन द क्लिनिकल सिनेरियो। इसी तरीके से हम आगे बढ़ेंगे। तो यहाँ पर भी एब्डोमेन में आपने बताया कि 30-40 टॉपिक्स इस तरीके से होंगे। हम डेली 2-2 3-3 टॉपिक करें तो 20 क्लासेस के अंदर ये खत्म हो सकता है। कोशिश करेंगे हम लोग किस तरीके से आगे बढ़ेंगे, हम देखेंगे आपका रिस्पांस क्या है, और इसी तरीके से यहाँ पर। तो दिस वाज योर क्लास।